चल admit कर देते हैं सामी.
Yes. And we wait for our expert to connect.
सीट देखा मैं आज काम. She said उनके घर में ना power नहीं था.
Oh,
A lot of people who come at that age, I guess, need
mm.
help. Okay, now we are live. Admit कर दूं, सामी?
I think.
Video.
Yeah.
Hi, now can you hear me?
Yes. We
I
need to.
joined from my brother's.
Yes.
Absolutely clear now. Great.
Yeah, we can see Mr. Joshi's name. So we need to rename you for now, right?
Yeah.
Yeah.
Can you do that or should I do that?
We will do that. We will do that.
Yeah, okay. Yeah, I'm so sorry for all that.
Come on.
No
These are
worries.
things
Great
that
you're here.
we have
Thank
learned
you.
with these things, you know.
Yeah.
And unless these happen, वो momentum और वो hype create नहीं होता है
And
with it.
this
Now
happens when
yes.
and this happens when you have to, do something, say something.
Yeah. Good evening, Rekha Ma.
Good evening, ma'am.
Can I hear you
Parul,
guys?
shall we
Yeah.
start?
Good evening, ma'am.
Yes, we can hear you, Rekha Ma.
Okay, I just want to say one thing. Where do you find these young, pretty girls?
That's Chinmay's sister. You know, Ma. Because
Yeah.
I have
My
met you
God,
at Raipur.
these
Yeah.
people are growing up so big. My God, they're even addressing the DSFI now. Oh my God.
yes, Ma.
Yeah, I'm so proud of your mother. Honestly, I think she has raised the
Wow.
most beautiful people. Yes.
Wow, thank you for saying that.
So please tell that to your mother.
Yes.
Yeah.
I have strictly told her not to join today.
और मैंने उनको अलग से लिंक भेजा है.
बस Sammy, तू वो कर दे Sammy. Tell her to come, please.
Because she's the only channel I reached. Sharayu wasn't there in the last IIDSC. So
Yeah.
Geeta ma'am को ही मैंने notify किया था. मैंने कहा please send this to
Yeah.
Dr. Sharayu Mirji. She's missing, so we want her.
So nice of you to come on our platform, and
Thank you.
so nice of
I
you to
really
be able
wanted
to.
to do something like this, so I was
Yeah,
really
you
happy.
continue to do, okay? Continue.
Yes,
We
now
need
you are,
lots of
we are
youngsters.
not sparing you now. We'll tie you tightly and tightly.
Yes.
Parul, you start?
जी नमस्ते दोस्तों, स्वागत है आपका हमारे आज के डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के शनिवार के सेशन में। मैं पारुल सिंह आपका स्वागत करती हूँ। आज हम एक बहुत ही खास मेहमान से आपको मिलवाने वाले हैं। वो एक डॉक्टर हैं और वो एक डाउन सिंड्रोम ब्लेस्ड सिबलिंग भी रखती हैं अपने साथ में, और बहुत सारी चीजें हैं जो हम उनसे दोनों ही एस्पेक्ट पे पूछने वाले हैं, लेकिन खास तौर पर हम उनसे ये पूछने वाले हैं कि जब किशोरावस्था हमारे डाउन सिंड्रोम ब्लेस्ड बच्चों में शुरू होती है तो क्या क्या चीजें होती हैं जो हम उस ट्रांजिशन को स्मूथ बना सकें। इसके लिए डॉक्टर शरायु मिर्जी को मैं निवेदन करती हूँ अपनी बहुत प्यारी सी दोस्त समीक्षा से कि वो प्लीज आए और उनसे हमें मिलवाएं। हम उनका बहुत बहुत स्वागत करते हैं।
Yeah, thank you so much, Parul, and good evening, everyone, and welcome in today's session. I mean, first, before I really go into the session, I want to mention all this, that with DSFI's consistent efforts of spreading awareness and reaching out to the new parents of persons with Down syndrome throughout the expense of our country, and with the experience and guidance of our senior parents, we all get to receive in our annual gatherings, we, the parents, fellow Humsuppers, have reached to a better understanding of the diagnosis of Down syndrome. And these days, DSFI's website and social media accounts, you go to, they serve as a wealth of resource and information about early interventions, health issues, life skills, financial planning, to education, to sports and games, to performing arts, vocational training. You name the concern or aspect, revolving around the person with Down syndrome. And I think most of us, those we have covered. And we have discussed in length and with many different experts from different parts of the country. Furthermore, we now know that prompt assistance and persistent work by caregiver can significantly enhance the quality of life and enable satisfying lives for both adults and children born with this condition. Unfortunately, the health problems can be managed well, especially when found early, and many resources are available to help kids and their families. And we are happy that from within our own community, we are able to bring the parents and the siblings of our self advocates to share their knowledge, expertise, and experience to encourage and equip the fellow Humsuppers with the right way of supporting our champs. So, as Parul mentioned in today's session, also we have a brilliant human, a proud sibling, a doting daughter, a meritorious student, and a professional with fine skills. She's a sibling to our champion Chinmay, and today she is with us in her professional capacity to help us understand how can we navigate puberty with the persons with Down syndrome. We extend a very warm welcome to Dr. Sharayu Mirji, who is an MS of BGY, MRCOG from UK, fellowship in gynecologic oncology. At present, she is associated with many maternity, surgical, and diagnostic center, hospitals, and polyclinic at Mumbai, where she has been rendering her services as obstetrician and gynecologist for more than 6 years now. So Dr. Sharayu, please welcome first and help us understand the roller coaster of adolescent phase and how we can better support our growing champs. Over to you.
Thank you so much for this. I'm really happy to do this. I hope I'm able to do justice to this topic. I'll start sharing my screen.
Ji.
I think.
Yeah, co-host, you are the
You
first.
can now. You can
Yes.
now.
Okay. Just a minute. Yeah, my screen is visible. No?
You have to share the complete screen, the entire screen. It's not visible.
Yeah, I did.
No, we can't see your screen.
Yet, yes.
Share screen, and you please share the audio also. There is an option of sharing audio. You'll have to share the audio also.
Okay.
Otherwise, we'll not be able to hear anything on the screen.
Okay. Yeah. In case I have some audio, then only. No?
Yeah. Only when you have a
But are
video.
you able to
But
see
keep
the
it on
presentation?
anyways, just in
Yeah,
case.
yeah.
But we
becomes clear.
can't see the screen. Can you see, Brenda, if the
No,
delay?
dear, I cannot see the screen.
Yeah.
Okay. Is there a delay? Just a minute.
Nothing.
Maybe you could also share your presentation with Sammy in case you're not able to share
Yeah,
it
yeah.
yourself.
And you can say the next slide. We can move it for you.
Yeah. So it's still not visible, no?
No, it is not.
Okay, then I'll do one thing. I'll share it with you.
Yeah. It really makes you feel more empowered when from within community we have some expert, because we have our parents, the siblings of our champions working in different areas where they have achieved their own expertise and their own knowledge, and living with the person with who has the diagnosis can be so benefiting for us. So this is in context to the rest of the parents who have joined. Like if you have something which you can contribute to the community, please feel free to connect to me, Parul, or Brinda, and we will fine tune the session with you.
Sammy, the most important thing here is the
Yeah.
fact that they have lived with it.
Yes, yes,
And living with somebody who has any challenge, anybody, even your own, even if they don't have a challenge, you
yeah,
understand your siblings much better. So to portray that and to bring it out in a
yes,
better light, I think it needs to be from within. And I can see this young girl who has lived with it, enjoyed it, and learnt every bit of it. It's so beautiful that we don't want everybody to become a medical person, but we can
yes,
always have one. And the strongest group that we have is a sibling group, I believe. And
absolutely.
they are all coming out loud and clear and saying, oh, let us contribute, let us take this one step forward. I think we need to just keep telling the siblings to all be there.
Yes.
But thank you so much,
Yes.
Sharayu. You're such a gorgeous woman, I tell you.
Yeah.
So I
So
shared my
I'm,
presentation.
yes, yes, I'm almost ready. I'm just
Okay.
opening it,
Okay.
and now I should come to sharing the screen.
Yeah.
Just give me 1 minute because I'm also learning where to go for it. Okay.
I think
So
I don't know
where,
why I couldn't.
which is fine. I think that credit has to come to me. So uh, why I'm not able to find the share screen option in my screen?
एक बार शेयर हुआ है समीक्षा
I
जी।
think I'll.
I saw it, Sammy. It came up.
Okay.
Am I right, Parul? It came up, right?
जी बिल्कुल एक बार शेयर हुआ है अभी फिर आ रहा है
Yeah,
यस
it's
एक
there.
बार
It's there. Yeah.
Yeah.
You can see. Sharayu, you can see Dr. Sharayu?
Yes. Yes. Yes.
Yes. So I am at your command now. Whenever you say next,
Yes.
I'll move.
Yeah. So yeah, as Rekhama said, I think I'm more in the capacity of a sibling than a doctor today. So yeah, so let's start. Um, so my topic that I chose for today was navigating puberty in children with Down syndrome. I'm a gynecologist, so I deal mostly with girls. But yeah, I'm going to talk a little bit about the boys also, about what changes they go through and what to expect in that. But of course, I would say I'm probably not an expert at that. But
Absolutely.
yeah, so let's go ahead. The next one. So, puberty, as we all know, it's actually a very challenging time for any child. All neurotypical kids also go through a lot of difficulties during puberty. So, especially so with our special kids, because everything is different for them. They find it definitely more difficult to even communicate what they are going through. Parents also find it difficult to understand what is happening. So, all the more reason that we should know what to expect and how to help them get over it. And adolescence, as we all know, is if it is handled very well, it definitely helps in the overall development. To help them become more developed individuals as adults. Next one. So this is just a list of things that we'll go through. I'll first just talk about the physical changes that happen in both girls and boys, and how is there any difference when the uh, kid has Down syndrome. Apart from physical changes, there will be some emotional changes, some social changes, any specific challenges that we may go through, and one concluding slide. Next one. So the physical changes. Next one. Uh, so basically, there's a surge of hormones, as we all know, when puberty hits around 10, 11, 12, 13 years. So basically, the age can differ. Nowadays, it has been seen that it is seen at a younger age group. Somehow, because of increased exposure to a lot of things, obesity, the age of puberty has come down. So there are all these hormonal changes. There's a growth spurt, change in the shape of the body. Basically, the genital organs increase in size. There are secondary sexual characteristics. The body composition changes. Kids start getting acne, oily skin, because of which there's a lot of odor also sometimes, and sleep disturbances, along with the emotional changes that take place. Next one. So, so in girls, medically speaking, we have these four stages of pubertal development. First is the breast development. The breasts start increasing in size and forming. Then there is the pubic hair, axillary hair. There's a growth spurt, sudden increase in height that happens. And finally, the last stage is when the menstruation begins, the menstrual cycles begin. Next one. So in Down syndrome, there can be a little change, as in many a times it has been noticed that the puberty age is a little earlier in girls with Down syndrome. They may have irregular cycles. Some girls do have heavier ones, but some also have lighter ones. So that differs. Breast development may not be so complete. It is a little delayed. It has been observed in various studies, and sometimes the hair growth is more. Also, obesity is seen in both girls and boys with Down syndrome. Next one. So in boys, the changes that usually happen is the same, that is increase in the genital organs, pubic hair. Deepening of voice is something that is more specific to boys. Facial hair, again, the height increases, and acne and body odor. Next one. Uh, in boys with Down syndrome, usually we see that puberty is a little delayed. The height is short. This is again for both girls and boys. We've seen that Down's kids are a little shorter. The testicular size, the length of the penis may be a little less. Body hair may be less. Even the deepening of the voice is less. The fertility is reduced definitely in Down's males. So that is one thing. Next one. But of course, the physical changes are different. Each child is different, and the way in which puberty hits and the changes that happen are different for each and every kid. Some other issues that we encounter in Down's kids more is thyroid issues, obesity, short stature, sleep disturbances. They have very light sleep. They have sleep apnea because of obesity, even type 1 diabetes, and decreased bone mineral density. They have a little weaker bones, and mental health issues can also be a little more with our kids. Obesity, of course, there are other factors which are contributing, like because less activity, um, lower metabolic rate, physical activity is less. All these factors can contribute to already susceptible obesity. Of course, healthy eating. There are various practical barriers also to get regular exercise. So all that contributes. Next one. Along with these physical changes, there are I think more important are these emotional changes that happen. A lot of mood swings, anger issues, irritability. They get throw tantrums a lot. So the next slide. Yeah. So in fact, our kids, they have this tantrum issue even before that, but this can get exaggerated during puberty. Anxiety, they can get conscious of their body changes. They can get conscious of social interactions. Even depression, they're more susceptible to that, and increased emotional sensitivity. Next one. Uh, they can so during this time, usually when they are kids, they are so much dependent on the adults, maybe the parents, the siblings, but now they can start feeling that they want to be more independent, and we as caregivers are extremely protective of them. So that can be a struggle. There can be a power struggle in that. They do get more interested in friendships, even romantic relationships, which we usually don't think about in our kids, but that can happen. They can become more self-aware of their own body, their own they can start feeling shy. All those things do come up in our kids as well. Next one. Of course, one difficulty in our kids would be we don't usually tend to discuss these things with them. They are not able to express themselves properly about what they are going through. So that becomes a problem. Also, they have less independence. Their skills, to travel, to have a social life is less. So all of that contributes to this struggle that they are going through. We always, as parents and professionals also, we always treat them as a kid, and that continues even when they become adults. We always feel that they need our protection, which sometimes may not be the case, and that they may not like and may not be able to express. So again, that can lead to resentment and more anger. Next one. Also, these kids, our kids are more, they do have a more tendency to have some psychiatric comorbidities. They are definitely more prone to go through depression, some behavioral issues, emotional issues. There's something called as, diagnostic overshadowing, which I came across while I was reading this, and I completely agreed with it. It says that if our kids do show some mental health issues, some disturbances, some behavioral issues, we will always blame it on the fact that, oh, okay, he has Down syndrome, so that's why he's behaving like this. We will not really take it up as some other issue, some other health issue, mental health issue. So that happens in many kids who have any kind of disability, that the diagnosis gets delayed. So that shouldn't happen. If we feel that there's something wrong, then maybe we should take them to a professional and get it diagnosed and treated. One thing I came across was this self-talk, which is very common among our kids. And they have said that it's actually not considered to be a sign of mental illness or psychosis. It's in fact a coping skill for them. They talk to themselves. It's a way of venting out their feelings. So that is okay for them. They do it. Most of them do it. Next one. Yeah, so as I said, there's a high this thing of anxiety, repetitive behaviors, even depressive symptoms, which becomes more during puberty, during adolescence. um, they can present with a lot of aggression, low mood, irritability, not sleeping well, not eating well, decreased interest in the activities that they are usually interested in, uh, not able to socialize or not wanting to socialize. All these can be signs of depression. So if at all we feel that this is more, then we should get it checked out. Next one. So these are all the changes that we can expect during puberty. What we can do to help them navigate through this and to help us as well. Of course, communication is the best. We should always try to talk to them and explain to them how they should cope up. One is, of course, hygiene, because now, because of for girls, because of menses, even for boys, because of hair development and all of that, um, we have to reinforce good hygienic practices, regular showering, shaving, managing the menstrual cycles, menstrual hygiene. Um, Maybe we can use some visual aids, some simple language. It depends upon the child and the IQ, how we explain it to them. Emotional support and reassurance is the most important, and maybe regular health checkups to make sure everything is okay and address any concerns that may be there. Next one. I just put in some this thing about menstrual hygiene. Uh, so we have multiple options. I think, but for our kids, maybe the sanitary pads would be best rather than tampons or cups, because tampons and cups becomes a little invasive. They may not be able to manage it, but they might also. They can do everything. So we can, of course, teach them about hand washing before and after using any product, or using the restroom before changing. We have to, it's a good practice to change the pad every few hours, irrespective of how much the flow is, changing the tampon and how to clean the pad. Next one. So, some basic tips which we need to maybe keep on talking to them about, keep on reinforcing so that they are able to do it every time. Proper disposal of the sanitary product, using breathable, lightweight undergarments. Most importantly, keeping that area clean. It's only important to wash the outer part of the outer part, that is the vulva. There's no need to wash inside. That is one thing that we should explain it to them. Not to use soaps, only water, and while wiping, only from front to back, never from back to front, because that also gives rise to infections down there. Adequate water intake. Next one. Of course, a good healthy diet, because as we already discussed, these kids are more prone to obesity as well. And so inculcating healthy eating habits right from the beginning is very important. Once they get used to eating a lot of junk food or something that is unhealthy, it is very difficult to get them off it, because they are definitely more adamant, they'll not listen. So eating healthy, drinking enough water, most important. Exercising also, it improves the muscle strength, the agility, also to maintain the heart health. Many kids do have some heart issues they're born with, so all the more important. Sports activities may be the best way for that. And because they have low bone mineral density, even calcium supplementation is recommended. Of course, the doctor would prescribe it. Next one. Uh, this is probably more important. The physical aspects we all take care of, we explain the nutrition, but the emotional support probably lacks. So I feel communication is the best way for them to open up, and for us also to make them feel that it's okay to talk about these things. It's okay to talk about whatever they are feeling or whatever they are going through, to validate their emotions and support them. Sometimes to manage this anxiety and stress, deep breathing exercises, physical activity plays a great role for this. Next one. Uh, social skills training, what is done in most of these schools is it plays a great role in, once they find friends of their own, they definitely are happier with their peers. And uh, hobbies are very important. It will help in building up their self-esteem and emotional well-being. And if they are able to form good friendships, it's the best, because many a times this loneliness becomes a great problem. So if they have some activity, some hobby where they go regularly and do it, because they are very good with sticking to routines. So if there is a great routine wherein they have some place to go and do some physical activity every day and meet other people, it plays a great role for their social well-being. Next one. Next one.
We have done this.
So sex education for these kids has to be, of course, a little tailored. It can't be like neurotypical kids. So depending on each kids, we should attempt to explain to them all these changes that are happening. And along with that, the life skills and the academic support is ongoing. That also helps. Next one. Of course, family support, healthcare support, and more importantly, mental health support. Not to ignore any signs of mental health issues, just saying that it's because it's Down syndrome or because it's puberty. It can be something which is underlying, which has come up during this time. Next one. Some specific challenges. I just thought I would talk about masturbation, because many boys. So obviously, Downs kids do develop physically. They are normally developing, so they do get these urges. They can get this urge of masturbation. So we need to, if at all we see that behavior in the boys, we need to talk to them about it, teach them about privacy, teach them that it's okay to do it, but not openly, not in front of people. Teach them what it means to, teach them that they can do it, but only when they are alone in a room, and set those clear boundaries. If they know that it's okay, they are able to, then do it. um we can, so these kids can also have what we call as wet dreams, where they do ejaculate in their sleep and they don't even come to know. So it is some, and parents also sometimes get alarmed if this kind of thing happens, but it's okay. It happens. It's a natural process. So that is what we also should be okay with. Next one. So yeah, so the same thing that to we also need some coping skills to help them get through all this. Talking to them regularly helps. If at all the anxiety, depression do come up, then therapy definitely helps. And I would say physical activity is the most important. So if they are into some kind of sport, some kind of exercise routine, that helps. Next one. This could also be a good time to teach them about the body parts, to teach them about privacy. I think we have had sessions of all this good touch and bad touch. So this could be a good time to talk to this and, to teach them what is okay and what is not okay. So they can, express their needs and boundaries in front of people as well. Next one. So yeah, that's the end. Basically, individualized support and care, to seek help from the professionals, and a comprehensive support system, especially with the family, that will help them to go through this and thrive through this stage of puberty, which is so important. Yeah, that's it.
Thank you so much, Dr. Sharayu, for giving us this beautiful presentation covering all the important aspect. Yes, we need to work upon all of it on individual need basis. That's one foremost thing we need to understand. But as a typical person, you start from what you all know,
Hmm.
not from what is required. So that we really need to unlearn and relearn that how we can start at their level and at the moment what is required. Right, Parul? You will agree with me?
बिल्कुल बिल्कुल सही कहा समीक्षा। और मैं भी धन्यवाद करना चाहूंगी डॉक्टर का कि जितने अच्छे तरीके से उन्होंने और बिल्कुल एकदम कॉम्पैक्ट तरीके से इतना बढ़िया प्रेजेंटेशन बना के हमें सारी चीज़ों को कवर कर लिया है। ये हमें जो है दिखाता ही है कि हाँ, हमने किस किस उससे गुजरना है। और जब ऑर्गेनाइज्ड वे में हम काम करते हैं तो वो हमेशा अच्छा होता है। इसीलिए हम चाहेंगे हमारे दोस्तों से, अगर आप डॉक्टर से कोई सवाल पूछना चाहते हैं, आपका बच्चा किसी भी एज का है या वो एडल्ट है, किसी भी तरह का इशू आप फेस कर रहे हैं, आप अपने आप को अनम्यूट करके हैंड रेज करके सवाल पूछ सकते हैं, या फिर आप अपना सवाल चैट बॉक्स में भी हमें भेज सकते हैं।
Yeah. Because we all understand the aspect of the lack of emotional maturity makes it very difficult sometimes,
Yeah.
and they require plenty of information,
Yeah.
vocabulary,
But I
and
feel
guidance.
as
Yeah,
the differences with neurotypical kids, we have a lot of friends, we can
yes,
discuss with them, we can
psychosocial.
talk to
Yeah,
them. The
yeah.
problem with these kids is, who will they talk to? Who will they discuss?
Absolutely. Their routine is actually tailor-made because they have
Yeah.
therapies, they have a special thing to do, they have a different routine set up right from the childhood,
Hmm.
where the bodily aspect, even we as, growing adolescents, we have undergone so many, developmental problems where we had these issues, but we could not discuss with our parents.
Yeah.
हमारे
Yeah.
time पे तो और भी,
Right.
it was just a new thing.
Yeah.
Today, so we are talking about it. There are advertisements, there are books available
Exactly. Yeah.
where
Yeah.
the teenager can reach out to or get the information. But yes, to our children, to make them comfortable understanding,
Hmm.
that's why I think the mental issues also happen, because the lack of
Yeah.
understanding of their own
Yeah.
body, what is
Hmm.
happening, how to respond to it, and how to cope with it. There is a lot
Right.
of gaps
Right.
to be filled in. Oh my
Right.
God, thank you,
But
Sharayu. Yes, Rekha,
some, yeah, I can you hear me?
yes, ma, we can hear you.
Yeah, you know what? I wanted to tell Sharayu one thing. I think it also depends on the family.
Yeah,
Hmm.
Now, what is happening? The individual, as they're growing older, unfortunately for us, because we are an overprotective race,
Hmm.
and we never think they are growing up.
Yes, that's true.
We don't allow them to grow up naturally. At every point of time, we are saying they are people with Down syndrome, so maybe this is how we have to do it. So there is also a cover up on every issue.
True.
And when parents talk to us, they say, "Are you sure they really know this feeling?"
Hmm.
And
Exactly.
this is very frightening, because honestly, they feel that our children do not even have or can emote.
Hmm.
yes,
And this is what I realized, that with my own daughter, I'm talking about 30 years ago. uh, Once you have reached that stage where you're in the pubertal stage, I myself was a little, because there was nothing to fall back on. I didn't have anyone to talk to, and I didn't realize that she was actually reaching out to my friends to discuss issues. So it's not always peers that help our children.
Hmm.
yes, ma'am.
This I want to tell you. This large section of people that you create around them has to be also my friends. And if it's a boy, it's his father's friends or his siblings friends, somebody who he can open up and talk to. because his peers might not be in that position to discuss this with him. And I don't know whether they make those type of really good friends at the age of 9, 10, 11, 12.
Hmm.
And we are not in a position to think of them as grown-ups, that they have their body demands, their needs, their desires. And I'm telling you, because when Bubbly demanded that I need to be married,
Hmm.
I mean, it was natural. So, but in our whole family, 20 years ago or 22 years ago, they said, please don't even discuss it. It's not allowed, because she's a different person. She doesn't have a right to be married. So understand that the pressures of the society, the pressures of the family. Sit down with your entire family. One, just like you're a very understanding sister, I think the siblings make a lot of difference. But if you unfortunately have or don't have a sibling, find a group of people who you can sit with, like a doctor like you, who can make friends with them. Because I made Bubbly make friends with her gynae.
Oh.
And the gynae would explain everything, that this is normal. She said, no, I want to talk to you alone without my mother. And this surprised me, that she was quite verbal about it. And she said, please leave the room. So at 13, I mean, my point is, we are not allowing them to.
Yes.
So it's not that they don't want to. Like, many of our children are very vocal when it comes to them, and they can get very aggressive when
Yes.
you are not giving them that opportunity. So I believe that it was explained so beautifully. Now, you're not going to go away, Sharayu. You're now going to explain it to every person who has Down syndrome, and everybody is going to come up to your doorstep, and you are available 24/7. You have no other job.
Yeah.
It's
So
going to
we
be a big
love it,
bullying
Deep.
session. I'm saying, like you said, peers, here it will be family and
Yes.
support systems and
Definitely.
caregivers.
Yeah. Yeah.
So
They have to
let's
have those.
expand that into a larger horizon. Okay, open the nothing. Parul, I'm sorry, I keep talking and Parul looks at me like that. Yes, Parul, you can open up
He really
your
gets
entire
mesmerized
thoughts to the
अच्छा
public.
लगता है
by
जब
the
आप
way.
बोलती हैं, आपको सुनना
Yes.
हमेशा ही अच्छा लगता है। Yes,
Yes. By the way, I want to bring it to notice that we have also international audiences nowadays in our session. So we might have questions from the neighboring countries or the countries in Asia Pacific with us. So here the question is asked about period panties. So I think it's a product, and the one who has used the right person to say about it, that how it feels, because personally I have also not. So we would want to know, Sharayu, have you come across a case where a person with
Yeah.
then special needs or a typical person is talking about period panties, and how was their experience? Can
So
you
I
give?
think period
Sammy,
panties
everybody is
are.
using it these days, Sammy. You're very outdated.
I know.
My mate's daughter got her chums, and I bought it and gave it to her. Come on now. You don't seem to be in.
I
Let,
have
let
to
your
ask
little
my
one grow up
mama
a
to
little
buy
bit.
it for me.
No, let your daughter grow up a little bit. She's going to tell you you're so outdated.
No, it's a
Right.
it's a great thing. I think it is more suited on those days where the bleeding is a little lighter, maybe towards
Yeah,
the
yeah,
end
yeah.
or the beginning.
That's true.
Maybe
That's
it
true.
may not be very good for the heavy days, but of course it's worth a try. Yeah,
Yeah, so we
because
can give this option to those who are starting with the chums, or they are not able to track the menstruation cycle, or it is irregular. So that first day they are on
yeah,
it, and
so they
then next
can
day they can
explain.
switch on to the proper man.
Yeah.
Yes, thank you for that. I hope, Valja, that answers your question. So, of course, it's not with the topic, but I would like to read this question. It says that, is there anything we've done for the second child? Because my firstborn is a child with Down syndrome.
So first child is child with Down syndrome, and
Yeah,
is there
for the
anything?
second child, anything to be done for the second?
Yeah, so before, I mean,
Very
before the birth of the second child, right? Yeah, so
Yeah,
Now,
there
yeah,
are.
Maran kar raha hai.
Yeah. So of
yeah.
course there are many tests now available. So whenever there's a Down syndrome kid, the genetic testing is done to see what kind of combination is there. There are different combinations for trisomy 21 as well. There are certain different the underlying defect that is there, in order to see whether, so there is one genetic mutation which can happen every time, the translocation pattern that is there. Unless if that is there, then that means that every kid can be Downs. But if that is not there, then there are certain tests that we can do during pregnancy in order to make sure that this kid is chromosomally normal. There are invasive tests where we actually get the entire karyotype of the kid to make sure it's normal. Yeah, so that helps
Yeah.
in.
Bishnu ji, if you are
Yeah.
there or you want to add or you want to ask more about it, you can clarify. But this has been answered in a form that you are expecting the second child and you are asking that at that point, what can we do when we already have a child with Down syndrome? So that's how we presume it. So yes, you can raise your hand like my parent Parul is suggesting if you have a question. The next question again says that, okay, it is from the same person who asked about the period pattern. It says that my daughter started with a period last month, which came just for 3 days. But this month, it wasn't like last month. I got worried and want to know about it.
So
I
when the
think,
periods start, now this is not just for Downs, it's for everyone. It takes around 2 years for it to get regularized, because the axis that begins the for the periods to become regular and cyclical, it takes 2 years. So for 2 years, you can expect that the periods will be regular. They might come after 2-3 months. They might sometimes come early. The bleeding can be a little heavy, especially when they come late. It may be heavy, it may be light. 2 years, no intervention is recommended. You can wait and gradually it regularizes. Of course,
yeah,
if it is too much, then you show someone so that they can just do some basic tests like thyroid and all. But usually, first 2 years, it's normal to have irregular cycles.
yeah. So I think, well, that answers your question. So Nina, ma'am, I think she is referring to the period panty question that her daughter is using it and it seems to be very comfortable for her. And she's a working adult and a grown-up person who has handled the menstruation for years. And now she's using and she's comfortable with it. So it's a good experience coming in. So we can always try. Like I
Yeah,
have to really understand how it works. So yes, can anybody else want to ask something?
Hello, I'm from Sri Lanka.
Hi, welcome to the session. Yeah, Sunita, you want to ask something?
Yeah, my daughter is 32 years now, Jinelli. She's 32 years and her periods are a little sort of irregular. And when she gets it as not much of a flow also. Is it going to stop?
So many a times now in Downs kids, we have seen that the periods might stop a little earlier as compared to the kids. So light flow is okay. Just make sure that there is no other underlying pathology which is giving rise to light flow. Sometimes thyroid abnormalities can make the periods light. Some other hormonal changes can make the periods light. If nothing else is there, then it's okay. Nothing
Oh,
to
we
do
tested
about
for
it.
thyroid. We tested for
Huh.
T4, T3. They were all T3, or they were okay, and no heart problems also. Only this issue.
Then it's okay. Yeah,
Yeah,
then nothing to worry. If there's no underlying
because
cause, nothing to worry.
it
Yeah,
was
they do have.
actually exactly she used to have it after 28 days, but now it is becoming a little longer. Anyway, she has it. So
Yeah. So
I
sometimes, so many of these kids do go through menopause earlier as compared to the neurotypical kids.
normal.
So I'm not saying she's going through that, but these period abnormalities can happen. So it's okay. I think you don't
So,
need to worry about
Yeah.
it.
Rekha,
and
ma'am,
This is an important subject that
yeah,
we are discussing now and doing a research. Sharayu, I will contact you on menopause and how early it can start with persons with Down syndrome. With my daughter, by 36, she had already entered the menopausal phase where it slowed down, and then it suddenly happened after 2 years, and she used to have hot flushes. She used to feel hot, cold, hot, cold. So there were multiple issues, and because she was also going through depression and schizophrenia, we had to handle this because people thought maybe it was a medication that was working otherwise, but it wasn't. It was definitely menopausal because I think because of the onset of aging in our children, they age earlier, and yeah, and she got her periods by the time she was 11. So by 36, 37, it had slowed down. Now she's 43 and she doesn't get her periods anymore. Just let it be very simple, and it will slowly stop. And yes, it can suddenly happen. You'll have to be prepared that there might be mood swings, and there will be a little bit of frustration, because in fact, Sharayu, in the middle of winter in London, she used to say, I'm feeling hot. So it's just like you and me. We burst out in flushes, and the same thing can happen to them. And the same. So keep a notebook and see how frequently. Everything has to be noted with our children. These diaries are so important for us to know when. Yes, Sharayu.
And is now has your daughter put on weight after that? After menopause, I mean.
Well, she did, but then it all began with trying to monitoring her diet and her exercise, and the routine went on. Definitely, there will be. It's like, come on, I think all of us put on weight during the time of menopause, and yeah. So it's just like us. There is nothing different.
Yes.
And I feel that her tummy is getting a little bigger. Maybe I get her to do some exercises also, but in spite of that, she puts on weight, and the tummy is also a little bigger. So I fear whether she is going to be very fat in no time to come.
So you already know the answer, Sunita ji, that you need to set in a good, healthy routine for her.
Yeah.
And we are very happy to have you with us. And good you asked, because it keeps all the parents, in a line that what are they expecting in coming times. And yes,
I would also like to say something
Sharayu.
that when menopause hits early, and if they are going through all these symptoms of hot flushes and other symptoms of menopause, there are certain herbal medications also available. So in case it's too much, you can consult a doctor and start those medications. That definitely helps to cope, because menopausal symptoms are more in the starting years. So if at all these symptoms come up, then these herbal medications definitely help. And also, if menopause is coming so early, calcium supplementation, vitamin D supplementation is very important, because then the bones start losing calcium.
Yeah. In fact, I wanted to speak to you yesterday. Then my husband said, "No, we have a session today, so we'll speak there." The thing is, now she underwent a phase of sort of depression, because I have 3 elder sons. The youngest is 80 years older to her, and all three of them got married within 1.5 years. And after that, I think she lost touch of them. They all left home and went
Might have become lonely.
Yeah, and she wouldn't get up. She would sit up in a place and stay there for a long time. So we had to take her to a psychiatrist, and she gave a mild depressant, and now she's okay. So I'm scared whether if she's going to face menopause, whether she
a lot of emotional and social support, I feel, has to come into play. And yes, we are all growing together, and I'm sure we will overcome this also. Rekha ma,
the most important thing at this point of time, when the family is the siblings are moving on in their lives, what would be important is that you build up that support system for your children. So, see, my son has left the country. He lives abroad. Now, it's not as if it's the end of the world. She leads her own life. Now, you have to build up that support system, which would be bringing in people who will keep her entertained any which ways, because it is not going to be possible to put the entire responsibility on the siblings. They have their lives, they have their
Yeah.
work.
Yeah.
So all you have to do now is to bring some friends, maybe your own friends, who will come and be companions to her, spend time with her. And honestly, there's so much we can do with our people. Just play
Yeah.
some board games, take her out to the and they love shopping, they love going
Yeah.
out.
Yeah. Yeah.
And there's so much to be done.
Mm.
My point is, it's all about how innovative we are. So yes, I think this does not impact depression. Comes, yes, it does come. It could also be low moods. It could be that they have mood swings. But yes, I think we have to take it one day at a time. And please keep a gynecologist before you suggest or give the calcium and the multivitamins by yourself,
Yeah.
because an overloading can also affect. Yes, Bhavna.
Yeah.
Yeah.
Sunitra
Good
ma'am,
evening,
you
ma'am.
need to visit India as soon as you can. You need to be in the IIDSC or the Down Syndrome Federation
Yeah.
of India gathering to see and to feel supported. Bhavna ma'am, you are adding something.
Yeah.
Yeah, I just wanted to add here for premature menopause, as ma'am said, as early as 36, or and especially for symptomatic
Yeah.
menopausal symptoms, there
Mm.
is now a provision for hormone replacement therapy also. Actually, it
Uh-huh.
was there years back also, but it
Mm.
went out of fashion in the sense that it led to lot of scare in public as well as doctors that hormone replacement therapy causes a lot of side effects,
Mm-mm.
leading to, cancer like things. But those all doubts have all gone away now. So hormone replacement therapy should be considered, obviously in
Mm.
consultation with a gynecologist.
Yeah.
That will
Yeah.
also delay many aging problems, as you said, because they
Yeah.
come with the menopause, and
Mm.
also improve their heart health, bone health. So for
Uh-huh.
early premature menopause, especially symptomatic women, hormone replacement therapy must be considered. Must be.
Okay. Thank you
Yeah.
very much.
So you need to consult a gynae in your country around you. So we come to the next question. It is about a daughter who is 12 years. After her periods, her body is experiencing a lot of changes. She is having big pimples on her private parts. We visited gynae and skin doctors also. However, she is not getting relief after having medicines. Please
Yeah.
suggest if any parent also experience the same. And Sharayu, if you can help the parent suggesting something.
Yeah, so this can happen actually because as I said, the skin becomes more oily. The tendency for all these acne and boils increases. With pubic hair also, the boils in the private parts happens. I think better to show a gynae. You've already done that, but yeah, sometimes it can be infected, so she may need an antibiotic for that. Maintaining good hygiene will
Hygiene.
play an important role. Maybe if the hair is the problem, then trimming it, keeping it clean and dry, that might help. But yeah, showing it to a gynac or also a dermat, that might help.
Yes, it can be very painful experience. I developed a rash during my period, and which infected my lymph nodes in my vulva region, and it was so uncomfortable to live those days. So you have to take care of the hygiene as a top priority, and how many times in the day you can wash or change your undergarment. It really requires that maintenance. Yes, the underlying concerns also need to be ruled out, like Sharayu mentioned. So this question, I think if Rekha Ma is there, goes to her that Velda is saying that she has two autistic children who have 3 years of difference, but are in their also in their puberty. My son is 14 and daughter is 11, and she's too much worried about the situation. So any
Uh,
advice you want to give?
I didn't hear the question. What was it, Sammy?
The parent writes that I have two autistic children, the
Okay.
same parent who has asked about period panty, and then
Okay.
so they have 3 years of difference, but
Uh-huh.
both of them are in the puberty area. Like my son is 14 and daughter 11, and she is very worried about the situation. So any guidance you want to give to this parent?
See, it all depends on the intensity of the autism also. You see, because if they are able to understand what you're saying, then you have to start reasoning from now. So it's a question of sitting them down and practically pinning them down and talking to them. I don't have too much experience with autistic children. Let me be honest.
Yeah.
With children with Down syndrome, perfect. We can always talk to them. We can always sit down, explain to them, and they see, reasoning is something that people ruled out for years. But today, our children are not only reasoning; they are so rational.
Yes.
So use that the rationality that exists inside our children, and explain it to them with a lot of cues.
Yes.
The cues are so important. I think this parent has to contact us,
Yeah.
and we need to get onto a different platform, which will be with persons with
Yeah.
autism, because there's
Yeah.
there's a totally different way of handling children with autism. Okay.
Yeah. So, Wilda, I hope you will get in touch with DSFI. So,
Yeah.
the other question says that my daughter is 20 years old and has a personal phone. In these days, she likes to watch love songs on it. Previously, she used phone for studies and exercise. I'm afraid that she can watch other sites. Also, what should be done?
You can't. I don't know about Sharayu, but I don't think there is any way that you can block these things.
Yeah.
But you have to sit down and explain, and it's perfectly okay. Love songs. Oh my God, I listen to love songs even now.
Yes.
But that's not the point. The point
Yes.
is that they are growing.
Yes.
A child who is going through that emotional thing, and they want to. The reason they watch all these movie songs is because they relate with the hero. I mean, I was in love with Devanand a couple of times. Okay, so let's all get there and be serious about. I mean, these are not things that you can. You're scared that they might see some porno,
Yeah.
which is coming up on popping up. Even a 5-year-old is now vulnerable.
Yes.
So I think this needs a little bit of addressing, talking, and having
Yes.
a time when you see the screen time.
Yeah.
Screen time is very important.
Yes, we have to really uh, lay strict internet and phone safety rules.
Mhm.
And many other experts also keep coming on our platform and say that there has to be different safety rules explained when it comes to screen exposure also. So, I mean, sit down with your child or sit alone and define some safety rules, internet user safety rules, and give it to your child. And I'm telling you, a few sittings with them, they will come and watch you. It's too much of screen time you had, mama. Now keep your phone down and get back to work. And it works every time. They are the perfect people who can maintain discipline in your life also. But first, you have to invest a lot of your time and strategies which works best for your child. Right? Yes,
Yeah.
Leena ma'am is also mentioning that CAMS help adult with Down syndrome might not be easily go out and play with you or sit with you and start suddenly enjoying, the social activity. So camping helps. So and it works miraculously well. It is coming from a person who has been a pioneer in handling adults and growing adolescents in uh, in our country. So that's a good suggestion. Thank you, Nina ma'am. Yeah. So I
Yes.
think we have
Sammy, the most important thing, I think the most important thing is how to maintain time
absolutely ma'am.
and spend more quality time with your children. I think that's so important, and make sure that they are not, getting into all of these things, because the mind starts wandering when it's idle. And I believe a child should never be idle.
Yeah, there has to be a structured routine for any stage your child or your adult or your young adult or a growing adolescent can be. There has to be structured routine which has to change when they are, changing, like with age. So it has to be age appropriate, which you can actually do in your settings, not, venturing out for some different thing and which we are not able to continue. Right. So, I mean, there are a lot of time we have talked about it, and that's a very different um, uh, topic which we can discuss. That how to have a structured routine for different for a teenager, and it is individual specific. Like yeah, any problem or any other concern, health concern is like for me it will be different. For Parul it might be different, and for Brinda it might be totally different, or it doesn't exist also. That also can be the case, right? So I think we are done with the questions and suggestions came in chat box, and we are so happy we are managing everything in so time, Parul. We are so proud of ourselves.
बिल्कुल बिल्कुल अपनी तारीफें हम खुद ही कर लेते हैं,
I
लेकिन
know.
सच में आज का सेशन हमारे लिए बहुत ही अच्छा रहा है और मुझे लगता है कि हमारे पेरेंट्स को इससे ज़रूर फायदा होगा। और हम एक बार फिर से अपनी गेस्ट का शुक्रिया अदा करना चाहेंगे।
Thanks.
शरायु जी, बहुत बहुत शुक्रिया आपका, आपने अपना समय निकाला और आई। और जैसा कि डॉक्टर रेखा ने पहले ही कहा था कि आपको स्क्रीन पर देखना इतना सुखद है, इतने खूबसूरत आप हैं कि पूरा प्रेजेंटेशन हम आपको ही देखते जा रहे हैं। सो दोस्तों, बहुत बहुत शुक्रिया आपका। और अगले सैटरडे में हमारे शनिवार के सेशन में आप फिर आएंगे, बोलिए हाँ कि हाँ।
Yes.
हाँ हाँ
तो तो ठीक है वृंदा जी,
Yeah.
आज का सेशन हम यहीं समाप्त करते हैं। और जैसा कि लव सॉन्ग की बात हो रही थी, तो रेखा माँ के लिए हम आज फिर से एक बार फिर से गाना चाहते हैं कि प्यार बांटते चलो, प्यार बांट
Yes. So
thank you so
we can
much.
we can plan a joint
Thank you
session
so
with
much,
Dr.
Sharayu.
Sharayu addressing the other aspects of growing children, which can be a combined effort from, the person who's teaching sexuality etiquettes and the person who is actually taking care of the pubertal issues with our, growing girls. Thank you so much, Rayu, for we know that you are busy switching out between your hospitals, your clinics, and your consultations, but thank you so much for sparing your time, valuable
Thank you.
time, and your valuable experience with us. Thank you so much. And we are
God
coming
bless you.
again.
God bless you.
Thank you.
Bye.
Thank you, Brinda.
Thank you,
Bye.
everyone. Thank you for being there, Dr. Shari. It was really a pleasure having you. See you all next week. Thanks, Sammy and Parul, as usual. See you all
Thank you,
next week.
Vrinda
Till then,
ji.
bye bye. I'm ending the